Confusion erupted online after Trump decided to freeze the international aid. Dumela Kazi, welcome back to the cafe. If you are new here, welcome. And if you are returning, thank you so much for gracing us with your presence. Well, if you are new, please do me a favor of subscribing. Make sure you comment down below with your own thoughts. And also, please make sure you like this video. It helps a lot. Without wasting any more time, let's get into this video. Trump decided to freeze the USAID, and countries like South Africa are left with a lot of questions and confusion. So before we get into the whole ranting about this whole thing, let me say that South Africa is paying 78% of its own health care, right? 78%, and the rest is obviously the aid, like the USAID and all of those things, right? So that means South Africa is capable of paying its own health services, right? We can agree on that one. I don't know who doesn't agree on that one. We can agree on that one, that South Africa is capable of paying its own health services. But because we are living in a country that is riddled with corruption, we will have such confusions. I might sound controversial right now, but I feel like it was a good call for Trump to freeze it so that countries like South Africa, I know South Africa is not the biggest receiver of the USAID, but the countries like South Africa can be on a spotlight and be exposed for neglecting their own people. On top of that, South Africa doesn't prioritize South Africans. South Africa prioritizes everybody who comes into the country, whether you are illegal or legal in South Africa. This time around, when the US decided to pull off their funding, this was the right time to say, okay, from now on, we don't accept funding from the USA. We do it ourselves. This is the time that South Africa should say that anyone who comes into the country should have a medical insurance. No one who is not a South African citizen should receive healthcare service for free. We can't. I mean, South Africa was getting all this aid just to make sure that the whole continent is receiving free healthcare. Some of these African countries, they come here to pick up all these drugs or pills to go to their countries and sell them. So they get them for free here and go out to sell them. So those are the things that needs to be exposed because of our corrupt government. Just to make you aware that in most cases, the USAID was funding a lot of these health organizations, such as Tom Ivan or Ivan Tom clinics and those non-profitable organizations. My worry with that whole thing, I know USAID was not only the one that aids these clinics, these non-private organization or non-funded organizations, right? Those non-funded organizations, the NGOs, had people working in there. The messy part about this whole funding frozen and all of those things, those people do not have work now. And if it continues and there is no solution, as South Africa, we talk and talk, and our politicians will talk and talk and talk. They won't talk things that you understand. And the people who are suffering right now, who cannot access their pills, who cannot access their monthly visitation to these clinics and these private healthcare services that were funded by the USAID, they don't know what is the solution. They don't know what will happen. They're confused. They have no idea. They don't have access to the media the way that each and everyone who can afford data and proper cell phone or proper laptop, proper tablet or whatever you may call it. They don't have those things. And some of them, they are not even clued up to understand all this USAID and all of those funding and all of those things. When they go to these clinics, the clinic is closed. It says that's temporarily closed. Further notice, you must go to the government with your clinic card. Is government capable of solving this problem now? Are these people that were attending, or these people were going to these NGOs for assistance, Is government capable to suck them in and give them what they're supposed to get each and every month? Or the people are going to die first before the government is actually giving us proper information about this whole thing, right? Is it going to be another, oh, shame, man, the services have commenced and we lost 10 people throughout this period because people did not understand what is going on. People were not given proper information. The only thing that you hear, you see the TV, they're speaking in a very technical words and things that you don't understand as someone who is not an English speaker, for example. Right? It's disheartening and it's annoying that we still, after 30 years of democracy, we still rely on countries that are actually giving you aid just to make sure that they control you. Because countries like the US, they're not just giving you these aids. They're giving you the aid so that they can control you. If you're not doing a certain thing that they want you to do, they will revoke that aid. Or they will threaten you that you will see what we can do. It's the same thing that is been done by Trump. And Trump is saying that USA citizens first. That's why this whole thing was frozen. We need to take care of our people. We prioritize our own people first before we can release this aid. It's the same thing that needs to be done here in South Africa. We must say that we need to fill our own cup first before we can pour from this cup. We cannot pour from an empty cup. We can't. And the people who are paying taxes here in South Africa, thinking that that tax is going to a good use, it's not going to a good use. South Africa needs only 40 billion to actually cater for each and every South African. And they collect trillions of rands from tax. What are they doing with those trillions of rands? First of all, they underpay their healthcare workers. Secondly, these public hospitals are under-resourced. Thirdly, they are losing these specialists from these government hospitals. Canada is taking our own healthcare practitioners, our own healthcare workers, because they pay them right, they give them the proper equipment to use in the hospital, they take care of them. A lot of nurses, specialists, doctors, whatever, they are gone, went to Canada. And the ANC decides to actually poke on the NHI and all of those things. While we're still listening to the NHI, we don't know the solution of the NHI. We don't know how is it going to be done because they are confused. They will sign everything without knowing how they will deal with the implication or how they will deal with everything that has to do with that thing. Already, we've got that NHI there. Bella Bill is there. Now the land expropriation. The mismanagement within our government is going to cause havoc within each and everything that they're signing. Some of the things are good things that should happen. For example, land expropriation. Land expropriation, if it is done properly, and it is not the same thing that we see right now, because if you think that I am so excited with the land expropriation, you got it wrong. For example, I am not excited, especially that it is led by the ANC. They've got their own agendas, those people. That land is not going to benefit any poor person. And also on top of that, the poor people are not going to be given proper information about that land expropriation. It's the same thing that is happening with this health issue right now. The poor people are not going to be given any information. You would just have to go and peg yourself at the clinic and have those long queues and sit there for the whole day just to get a pill, just to get your monthly pill or whatever. You're going to sit there the whole day. The nurses are so irritated because obviously they are overworked, understaffed, and all of those things. Because obviously our own government prioritize anyone else but South Africans, not South Africans. We are the last people in their agenda. That is the reason why anything they sign, the ANC, anything that ANC signs, I don't trust them. I don't trust criminals. I don't trust them at all. So I feel like the USAID should stay there so that South Africa can fend for themselves. And I saw a lot of people were saying that, where's the BRICS? Why the BRICS are not giving South Africa this? Can we stop asking other countries for anything? Can we deal with our own issues? China has got its own issues. It's got its own highly populated country. And Russia has got its own problems. India, all of them actually. Can they prioritize their own people without us as South Africa asking other countries to aid us? The people who are up there, they should stop this corruption. Corrupt people must be kicked out of parliament. Corrupt people must be kicked out from our government. We have been saying this the whole time. And in one day, people will rise. And when they do, it's not going to be fun. And we don't want to see such things happening. We saw things like that happening in Mozambique. It's happening in Congo. It's happening anywhere else, that people are so done and tired of their own corrupt government. And right now, the USA is cleaning. They are cleaning their own place. They are cleaning. Trump is cleaning. Trump is not my favorite person, but he's cleaning. He's doing the right thing for his own country. The US first. When are we going to say South Africa first? When? When are we getting to that point where we say South Africans first? It's annoying, really annoying. Anyway, thank you so much for watching till this far. Please let me know in the comment section, what do you think? I know I was there and I was there and I was there today. I just said, okay, we need to do a good freestyle because I'm tired of this. We need to beg all the time. Why must we beg? Why must we beg? Yo, thank you so much. And please do comment down below, like this video. Make sure that you subscribe if you are not. I'll see you on my next upload. Have a fantastic one. Peace.